You're listening to the J&J Innovation Podcast, where each episode is a story of people positively impacting human health through innovation.
Hey there, and welcome back to the Johnson & Johnson Innovation Podcast. My name is Caroline Barretts, and with me today is Cris De Luca. Cris is the Global Director of Digital Innovation for Johnson & Johnson Innovation. He is tasked with translating data science and high-tech external innovation opportunities throughout J&J's innovation centers, JLabs incubators, and JJDC corporate ventures across pharma, consumer, and med device. Cris is a seasoned entrepreneur and intrapreneur who is driven to improve human health through technology and innovation. Cris was also named one of the 40 under 40 healthcare innovators by the Boston Business Journal and MedTech Boston. So without further ado, really excited to welcome Cris De Luca to the Johnson & Johnson Innovation Podcast.
Thank you, Caroline. Great to be here. I'm Cris De Luca, and I'm the Global Director of Digital Innovation.
Awesome. Thanks so much, Cris. It's so exciting to talk to you today. Really excited to hear about, your path to J&J, some interesting projects that you're working on, especially when we think about how important digital innovation is to healthcare. So to kick us off, could you tell us about your journey, your story? What's been your path to J&J?
Sure. Thanks for the question. So it's sort of an unusual path to J&J. I have sort of been founding myself on the corner of Kendall Square in Cambridge, Massachusetts, almost for my entire professional career. So I've sort of navigated that block, which is really a cluster of innovation that is the intersection of healthcare, technology, high tech, and engineering in large sort of academic institutions right around this vicinity. In my career, I've sort of navigated between this entrepreneur and intrapreneur sort of intersection, and really began in the healthcare industry at Novartis Pharmaceuticals. I was in the Institutes for Biomedical Research, supporting research informatics right in Kendall Square, when really that was the only entity on the block besides MIT. And within research informatics, we realized that there was really a focus on internal innovation at the time. So this was now sort of back in 2006, and there was really sort of how do we hire the best talent, bring it all in, do the discovery with our own wheelhouse, and using systems to connect all of that. But I sort of saw an interesting observation while being on campus. We were able to look on the outside, and I was seeing all of this emerging technology happening outside of the walls of where I was working. And so I really got that entrepreneurial bug to really break out and start to become an entrepreneur myself. And so with that, I accidentally founded two tech companies. One was sort of a massive failure right from the start, although we were bootstrapping. So this was sort of a 2008 time period where there was reduced capital in the marketplace. Startups had to become leaner and use that sort of lean startup methodology in order to really be able to prove value and generate that sort of product market fit by generating your first revenue, as opposed to celebrating how much venture capital you just raised. And so we ended up realizing that there was a good opportunity to be able to almost develop a platform for large corporate venture companies. We actually built an innovation as a service company for large corporate venture groups of Fortune 20 companies in the world to leverage our platform, which was designed to be both an online and in-person experience in building custom innovation programs to be able to provide really an opportunity for them to get small. So these large organizations realized that they weren't going to be able to develop all the innovation within their own organization. They needed to access earlier stage radical bootstrapping companies, and we provided that mechanism through hackathons, crowdsourcing, platform challenges, and really finding what it is that they were looking for in an extension of their team. We're able to help them scale and identify. And we built chapters in Boston, in New York City, in Silicon Valley, and this essentially became sort of a pipeline that they were able to get deal flow from in a very sort of almost outsourced way. So we were outsourcing innovation for these large-scale companies, and at the same time, I really wanted to get back home to healthcare. So we were sort of following any large organization that was interested in working with us. But we started to build out this healthcare vertical, and through that journey, got a meeting with Johnson & Johnson. They just announced that they were going to open a new innovation center in Boston, and presented on why they should hire my company to help them fill that pipeline. And they really sort of presented a reason of why I should join the company to help them open that office. And so lo and behold, I made the best decision of my life to jump into J&J and really join as a sort of co-founding member of the Boston Innovation Center. I was recruited by Robert Urban at the time, who was leading the organization, and through that really set out to help build what essentially I saw as a startup inside the largest healthcare company in the world. So really continuing to scratch that entrepreneurial bug or that itch, and being able to do that on the largest stage possible in healthcare seemed like such a rare opportunity. With that, we ended up building technology platforms, and a lot of the techniques and methods that you see today is how J&J scales through crowdsourcing platform challenges, was the incorporation of many of the techniques that we had built in my former sort of venture. And now today, my role is really looking across not just the Boston ecosystem, but really across the sort of global landscape, and helping connect our organization through technology, both from an operations perspective, but more importantly, even from an external innovation perspective, as we see the intersection of high tech and health tech and healthcare all come together.
What are some of the projects and initiatives you're working on right now that are really exciting to you?
Yeah, I mean, one of the interesting opportunities was, sort of a use case where you're bringing the best of both worlds. Actually, a couple of years ago, we partnered with an early stage company, actually in Boston, called Rest Devices, and Rest was building, this connected, and they had already, commercialized a connected wearable onesie with a little, turtle sensor to help parents, sort of monitor baby activity in the crib. And Johnson's Baby Division, sort of saw an opportunity to bring, or was asking the question, how do we make available all of the sort of clinical pediatric sleep knowledge that we've generated over the ages, but make this available in a very personalized way to consumers who are in dire need of that information and know-how. And so with this collaboration, we were able to bring to life in very short time and co-create a new product. So this was something that was very exciting, and it was launched at the Consumer Electronics Showcase a few years ago. And it really is an AI-driven digital baby sleep coaching system, the first ever in the world, to allow parents to help get their kids to sleep through the night. I would think what's so exciting about this is sort of the personalization factor around it, and that really brings together, in sort of its best form, the know-how and the capabilities of Johnson & Johnson with sort of the speed and agility of an early stage company. And so when you look at some of the interesting aspects of it, it's really has its own parent typing system in there. So really getting to know the parenting style from, are you a co-sleeping parent or a cry it out parent, and being able to marry both that type with the biometrics of the child, and then present in the form of coaching cards all of Johnson & Johnson's sleep know-how. And so this is really starting to now it's been commercialized now. There's also actually a website, you can check it out, called nodtosleep.com. So that's something that we continue to develop, and we see other opportunities, with that same, sort of application of learning systems, personalization systems, and AI-driven sort of recommendations that, J&J can potentially show up in the market, delivering its knowledge and capabilities through that kind of application. So this is sort of this is the crescendo towards more opportunities in that similar construct, and I'd look forward to, thinking of even broader, more even health specific opportunities.
Awesome. And what's so cool, Chris, is that it's evident that you've got so much energy and passion for this space. Can you tell me a little bit more about, why are you excited to get up and go to work today? Because, I mean, you're working on some really cool stuff. That takes a lot of effort and energy. So what keeps you going?
Yeah, I mean, I think it's sort of there's no better time to be alive and working in healthcare, especially as it meets this sort of health tech intersection. So when I look at, as a computer scientist, as a technologist, as a sort of entrepreneur, having that background, I can't think of a better place to put that time and that sort of scale in any other industry in the world, other than improving human health. So that's sort of the purpose, the reason, and seeing sort of I'm wired as sort of a problem solver, and to be able to see sort of so many sort of industry and endemic sort of issues in the healthcare ecosystem, the complexity around it, I sort of map it out as sort of a systems thinking and first principles opportunity to say, how can we actually break this all apart and put it back together in a way that actually could work? And I see sort of each of these problems as solvable through technology and sort of human interaction, and that's sort of what I'm all about.
Totally. Spoken like a true computer scientist, right? Take it apart, put it back together,
Exactly.
look at it as a system. That's awesome. So, as we think about the importance of health technology, what are big trends that you're seeing in your area that could significantly impact healthcare in, say, the next 5 years?
There's sort of this manifestation of new technologies that have hit the market, especially in the healthcare space. And I'm really pumped about seeing all of the venture capital and the innovation being injected into AI and artificial intelligence. I think that's one of the sort of most both hyped but also underhyped areas. Many people talk about how buzzy it is and how long it's been around, and this is just new vocabulary. While that's all true, there's we're just in like the dial-up phase of AI, and we haven't even begun to scratch the surface. And I think the more that we can start to see the use cases, we start to see publications associated with sort of narrow tasks where data has enabled good training of algorithms to be able to do clinical decision support, and we're starting to see some of that outcome data sort of manifest pretty quickly. It shows that this is not just a trend. It shows that this is really a new way for physicians to be, sort of scaled, for clinicians to have better insights into, what behaviors their patients might be experiencing, and early detect and support them. So I really see an opportunity or almost a world where AI becomes the new operating system. And if that's the new operating system with algorithms that are well trained and, ideally with unbiased data, and there's sort of the proper governance and ethics built into this, we really open a new door for almost passively monitoring human health. And what I mean by that is, some of these trends and technologies are, if you sort of look at the past 5 to 7 years, there's been sort of a wave of sort of mobile health technologies and wearable technologies, and they've been, marginally successful at best. It's been mostly a app for this and an app for that, and you can look at the 500 plus, 1,000 apps that sit in the App Store. Most of them have been never downloaded. There's about 40 that make up for all downloads. So you can sort of see why has that evolved this way. And I think there was really that was like the first wave of health technology that really hit consumers and then also the healthcare system. But now we're seeing sort of a maturity in the market where there's realization that you can't just put sort of a point solution for each experience. You really have to think of the sort of the human-centric design aspect of this, and really understanding not just at a sort of individual level, but you have to really look at all of the sort of ecosystem of issues that are going on at the disease level and what that might mean from an empathetic perspective. And so when you start to see some of these things come together, there's almost a new class of technology that I'm really excited about, with AI being the ecosystem. And within that, thinking of passive technologies such as using radio signals to monitor mobility and gait and measurement, being able to look at voice technologies as a new way for humans to interface with machines. So really taking the friction out of that technology aspect. The other dystopian version of this would be you'd have wearables on multiple wrists and a helmet and electrodes hooked up to you to supposedly get you healthier. And I don't think that actually improves quality of life, and I don't think that's actually a realistic scenario. That might help us get better data and better understanding of disease, but sort of the implementation of this will actually, I think, show up in maybe the most human possible way, and that's where the technology actually becomes invisible. Another track that we're working on is in the space of vocal biomarker development. So this is really the voice technologies, and there are a couple of ways to think about voice. So voice, if anyone that knows me knows that I'm very bullish on, in general, conversational interfaces. And that means, if mobile health was the, first wave of technology and how we would think about organizing health information, I believe that voice technologies will, and really finding people where they are, as opposed to trying to pull people into this app or, hitting them over the head with another badge notification. Being able to find people where they are, everyone knows how to use text messages. Everyone knows how to ask Alexa what the weather is today. And so when you start to think of what people are doing naturally in their everyday lives, you can start to think of how health might be a new experience in line with what they're already doing. And so this, could be, whether it's around a consumer brand or whether it's around a, health experience from a clinical trial, and being able to assess, how did you sleep last night? How are you feeling? And if voice is the right context for that, that's great. If it's more appropriate to do this through a text experience, maybe you're on the train and commuting in, that's great too. But having these experiences be entirely connected is something that I'm personally very interested in and enabling towards the future of health experiences. But what's even deeper than that is actually the opportunity for vocal biomarker development. So it's not just the fact that you have a new modality and speaking to a connected speaker, it's actually, or even a mobile device for that matter, but it's the fact that understanding that being new health data and voice as a new vital sign is actually really, really interesting, because the data is easy to capture, it's easy to collect, and there are, I believe, over 400 sort of vocal signatures hiding out in your voice data, the voice data itself as its own vital sign in our JLabs Toronto incubator called Winterlight Labs. And so we are, exploring with, their technology and understanding how Winterlight's voice-driven system and their biomarkers are able to early detect mild cognitive impairment, on when one might be on their way to Alzheimer's disease, and be able to predict that early is a really, interesting opportunity. So I think really looking at these low friction or invisible technologies that really start to push sort of behind the scenes and let people live their lives. But while that's happening, start to think of what this, new kind of, check engine light system that might be working on the back end to inform you early and sort of alter that trajectory. I mean, we talk so much about a world without disease, and I think this is one of the killer ways to do that. You sort of think of how do you surround a human, I won't call them a patient yet, but how do you surround a human with all technologies that they don't actually see, that doesn't interfere with their lives, but starts to sense and starts to inform and starts to sort of redirect and intercept when it's the right moment. And this could be from a both preventative and behavioral perspective, all the way down to, how we could early detect disease from, as I mentioned, AI systems. So I think this future is bright, and we have a lot more work to do. But these are some of the examples of technologies that we're seeing already make a difference.
Definitely. And you covered the whole spectrum there, especially, thinking about how we address patient needs across the care continuum. I want to circle back to the topic of AI, which you were kind of talking about the promise there and what's next. And what's interesting is you also bring up the point of data governance and ethics. And what's interesting in healthcare and what makes it such a peculiar problem to solve with AI is that, yes, we are collecting data more frequently, but there's also this issue of gaining access to it. And AI and machine learning, you need loads of data. You can't have an Excel doc with like 20 points, right? So can you talk to a little bit about, how you balance your optimism with AI with this big challenge that healthcare is facing of accessing the data needed to solve those problems?
Yeah, absolutely. I mean, such a great question, and certainly hasn't been solved. I think we are continuing to understand sort of the black box notion of, we expect these systems to be able to explain sort of the results. And so if we're putting sort of inputs in and we get an output, we want to be able to measurably and really go down to the root level of how a decision was made. And the reality is that even with human decision rationales, those aren't that concrete either. The sort of drugs, in many cases, you could sort of look at the science that goes into it, the discovery methods, but in many cases, we actually don't always understand a very detailed level of actually how it works. We know that the outcome can be, de-risked, can be efficacious, can have a certain level of profile, and that's done through clinical trials and robust trials. But actually, there's not as much of an understanding as we'd like to have. And so I think there'll be sort of a level of risk management and the kinds of data that goes into it. How can we actually, make sure that we're training algorithms on a diverse data set? Defining diverse data sets is a whole other topic. Diversity from geography, diversity of backgrounds, gender, race. It really goes across. But then also diversity on the engineers that are building the algorithms and their own sort of social and moral compass as they're coding their own morality into an algorithm. That's a whole other category. If you, just to step out of healthcare for a second, you can think of autonomous vehicles. And so you can look at someone who's building an autonomous, driving system. And when it comes down to making these kinds of decisions, when you have massive data coming in, the algorithm in the car needs to decide, hit the tree, hit the cat, hit the person, pull off the road. And those decisions are going to be based on, in some cases, Silicon Valley coders or Cambridge coders or people that are sitting in those driving seats. So I think you'll have to have sort of the proper regulation that comes, and we're starting to see the FDA sort of back in healthcare. The FDA just put out a paper that's saying how to sort of think about AI regulating framework. So I think it's interesting to sort of watch the emergence, but we can't wait for the perfect framework in order to be able to build some of these innovation-based systems. I think this needs to come. Obviously, we can't roll this out and make life or death decisions. These are going to be a new kind of data point. It will be a new kind of data point for physicians today in the healthcare setting on how they can identify patterns, how they might be able to spot check diagnostics. Specifically in the radiology and pathology spaces, we're starting to see these kinds of examples come to life. And this can't be the only decision. This has to be sort of just another helper. That's where it's beginning now. But I think, being able to look across these different applications starts to bring all these questions up. And I think we're just, again, scratching the surface. But it shows that there's already evidence here that this is something that will happen, whether we like it or not. And we better get our heads around it and understand how we both regulate it, how we accelerate it, and how we introduce it in a responsible way.
I love the phrase coding morality, and it brings to mind Google and I believe Apple just dropped the college requirement for engineers. So as we think about solving these enormous problems with technology, like what you were just talking about, coding morality into these algorithms that have life and death decisions, as a serial entrepreneur yourself, how would you suggest that we, either educate or help rein in a lot of those, big thinkers that are teaching themselves to code and may not go the traditional route of college or grad school? How would you suggest that we kind of build this technology community to follow this, moral code?
I think it's a great question. I mean, I look at sort of what's happening right now from just a pure talent perspective. And sort of thinking a lot, many times I think about the big tech factor in healthcare, or I think about the sort of small tech factor in partnering in healthcare, but also sort of, what it takes to sort of change that DNA of both sides. And what's, sort of, I would say a really interesting maturity in talent is not just chasing the cool job with the free snacks and the bean bags and sort of that environment. People and new talent today are looking to be mission and purpose driven. And so if you're going to be if you're going to bring your AI skills to bear, it's clear to me that people want to be able to point that at a real cause that's going to change humanity. And healthcare is well poised to be able to recruit top technology talent in order to provide that mission associated with that skill set. I think that's not the be all end all, but I think what that shows is even technology companies realize that actually healthcare needs to be a critical component of our organization. It's not just selling more advertising. It's not just selling more product, but what does all of this mean? Can we use the advertising to recruit for clinical trials better? Can we think of our products as new ways to monitor sensors or sort of monitor behaviors? Can we use our infrastructure to enable logistics of healthcare delivery? And so I think as you start to see some of the core of the big tech companies be able to shift into more mission-driven causes, sort of talent is now flooding the marketplace, and realizing that you really need sort of multidisciplinary teams in order to be able to solve this. So we're seeing even in healthcare and in the startup space, before there was a boilerplate, and you would see the health tech company would have sort of a CMO, a CSO, a CTO, and sort of the CEO, sort of the classic. Now we're seeing actually the designer founded the company, the technologist, it came from maybe healthcare or not. So there's really I would say it brings a little bit of the challenge, but also the opportunity. And the beauty of this is that people are sort of flooding around the opportunity to build really innovative, novel solutions, but the makeup and the profile of the team is something we've never seen before. I think the real watch out, and this is how we think about when we partner with companies is making sure they understand where their weak points are and where their strengths are, and how sort of they're bringing in all of the right talent to be able to sort of round out what that capability of the team structure is, but also the recognition of who they need to partner with when it comes down to it. Because, you can't have it all. You can't scale within a small organization. You bring the agility, the speed, and the sort of future thinkers, but be able to sort of grow to that scale and be able to do it at a regulated and commercialized way. You'll sort of need to partner with companies, and those who understand that early are the ones that we see actually asking for help and raising their hands early, are the ones that we actually see being what sort of most well positioned for continued future growth.
Totally. And what's so exciting is that, that's where the market's going, right? I mean, everybody understands that there's a need to, if you don't come from a technology background, there's a need to incorporate it into your daily life. I mean, it's just unavoidable. And we think about how important this work is. And again, we talked about earlier how much passion and energy you have for this. And we often find in work and life that, when you change one thing, everything changes, that ripple effect. So as you think about your life and your story, has there been a particular event, either personal or professional, that set you on this path or led to your biggest success?
I think, it's sort of interesting. It's sort of the, now spending time at J&J, I look back and I realize that the things that people are most curious about in terms of colleagues at J&J, they're most curious not about my 7 years at Novartis and how sort of other pharmaceuticals operated. They're most interested in those 3 years that I spent as an entrepreneur. And to me, I realize, in hindsight, actually that was like one of the most life-changing experiences, because going through sort of the hustle, the grind, the pressure, the frustration, the emotional roller coaster of building something from nothing, building a team, being able to generate revenue, being able to pay employees, being able to cater to customers, being able to adapt quickly. Again, we bootstrapped this company, and that meant we raised no external capital. We did everything based on revenue. We did everything based on our own work. We were the marketing team. We were the technology team. We were the CEO, the CFO. Everything was under a very small team. And getting into meetings with the chief innovation officers of GE and Dow Chemical and Shell, some of the biggest companies in the world, sitting across the table from these top leaders was, it's sort of eye-opening that, anyone who has an idea can actually and should actually act on it if you think you know what you're doing. And even if you don't know what you're doing, you should still take that risk. I think there's, nothing risk, nothing gain, but I think it's always a life lesson. And that was by far, of everything in my, 18 years of professional career, I would say those 3 years were really life-changing. It changes how I think about every problem. And even when you're in a large company setting, to treat it like you're still a small business. And if you treat it that way, all of a sudden you're freed from politics, you're freed from corporate structures, you're freed from slow PowerPoint processes. All of a sudden you see that as something that you can actually do. And you just look at who are the right people that you need to call in, who are the minimum number of people you need to call in order to solve this problem, but that bring the right brain power. And suddenly things just you start to do this sort of, kung fu on every problem that you see. And you think of, responsible hacking across these paradigms. And it's sort of so interesting to sort of look at that. It doesn't matter if you're in a big company or in a small company, but being able to treat everything like a possible hack, I think is something that will free you from anything that moves at a slow pace or anything that you sort of blame the ecosystem or the organization for. So that has just been life-changing. At the same time, I'm a father of 3. That was my first baby, actually, though, building a startup and being able to grow it. I still look at, being here as a continuation of growing that startup, having left that and now sort of operating at a large stage company. The other life event, obviously, was becoming an actual father of 3 children, and that has been just life-altering and really changed my perspective on care and being able to nurture and being able to, really be selfless, and whether it's in the work environment or being in the home environment, realizing that it's all about that continued care and that continued development of whether it's a company, a partner, or a child.
Cris, this has been so much fun to talk to you. Really interesting stuff. Really excited to see what comes out of the digital innovation arm of JJI. Thank you so much for your time. It's been a pleasure.
It's been a pleasure. Thank you so much.
The J&J Innovation Podcast is brought to you by Johnson & Johnson Innovation. For more information, you can find us at jnjinnovation.com. Special thanks to Ryan Flynn, who was instrumental in making all of this happen. The J&J Innovation Podcast is produced by Caroline Barretts and Ryan Flynn. Thanks for joining us, and join us next time for more stories behind the big ideas in healthcare.